If your mouth feels like the Sahara Desert at noon but perfectly fine when you sleep, the culprit might be sitting in your morning pill organizer. In this video, we're looking at why your AM routine is drying you out. Hello, Silver Smile family. Today we are solving the daytime drought. It's a common paradox. We often think aging just makes everything drier. But the problem isn't always age. It's timing. We're going to cover the anticholinergic effect, why your coffee counts against you, and 3 simple swaps to keep your saliva flowing until bedtime. Let's get into it. I want to start with a tough truth. Dry mouth, or xerostomia, is more than just annoying. It's a health threat. If your saliva is running low all day long, you lose your body's natural defense against tooth decay and gum disease. This is critical for anyone over 60. But why only during the day? That's the mystery we need to unlock. When we sleep, our saliva naturally slows down. It's called the resting flow. But if you wake up with a moist mouth, you know your glands are still working. When you are suffering all afternoon, that points to an external agent. Something you introduced into your system in the morning that only peaks hours later. The chief external agent for adults over 60 is almost always medication. Many common medications have an anticholinergic effect. That's a big word, but it just means they block the chemical signals your body uses to produce fluids like tears and, crucially, saliva. Your brain gets the signal. Stop wetting the mouth. This isn't a side effect of one specific drug class. It's a risk with many of the prescriptions you rely on every day for a healthy life. Think about the first 2 hours of your day. You take your morning pills, maybe a blood pressure medication, perhaps an allergy reliever, or maybe something for incontinence or anxiety. These medications don't instantly rush into your system and peak. They take time to digest and reach their highest concentration in your bloodstream. For many oral medications, that peak happens right around lunchtime, 2 to 4 hours after you take them. That's why the Sahara Desert feeling hits hardest when you're trying to eat lunch or talk on the phone in the middle of the afternoon. Let's look at the most common culprits. If you take a tricyclic antidepressant or certain older antihistamines for allergies, or perhaps a medication to control an overactive bladder, these are all highly associated with this drying effect. Blood pressure medications, especially some diuretics, also reduce the overall fluid available in your body, impacting saliva. These medicines are essential, so we are not telling you to stop taking them. We are talking about managing the side effect. So, how do we confirm this link? The first simple action step is to create a hydration log alongside your medication schedule. Over the next 3 days, simply note the exact time you take your morning pills and the exact time your mouth starts feeling painfully dry. If the timing consistently matches that 2 to 4 hour window, you have strong evidence that your morning medication is the primary cause of your afternoon dryness. Now, let's look at the second major daytime culprit, diuretics. These are medications designed to help your body shed excess fluid. That's great for your heart, but not so great for your mouth. Every time you pee, you lose fluid that could be used for saliva production. Diuretics are a necessary part of the routine for many people, but their effect is magnified by 2 common daytime habits we need to address immediately. The first habit is the morning coffee ritual. Caffeine is a natural diuretic. If you chase a diuretic pill with 2 large cups of coffee or black tea, you are running a massive fluid deficit before 10 a.m. You are doubling down on dryness. If you truly rely on coffee, try switching to a small cup of half-calf, or even better, switch to herbal tea that does not contain caffeine. This tiny swap can stop the double diuretic effect. The second habit is unconscious water sipping. Most people, when they feel dry, constantly sip water. While this seems helpful, it can actually wash away the small amount of beneficial saliva and the mucins, the sticky protective proteins that are meant to lubricate your mouth. Instead of sipping every few minutes, we recommend scheduled hydration. Scheduled hydration means you drink a full 8-ounce glass of water every hour on the hour from 9 a.m. to 4 p.m. Drink it slowly but deliberately. This helps you build up a sufficient hydration base that your body can draw from, rather than constantly washing out the beneficial fluids you do have. This intentionality is key to everyday vitality after 55. But what if you are taking a medication that is essential and you simply cannot tolerate the daytime dryness? We need strategies to manually stimulate the saliva flow and protect your mouth when the medicine is peaking. We need to employ gustatory stimulation. Gustatory just means taste-related. Your salivary glands respond strongly to sour and savory tastes. When you chew, your glands work. When you taste something sharp, your glands flood your mouth. We lose this stimulation as we age because many seniors gravitate towards soft, blended, or less complex foods. Try this simple countermeasure during the peak dry time, that 11 a.m. to 3 p.m. window. Introduce something tart or acidic. This is a simple, actionable step you can take today. A lemon slice dropped into your water bottle is a great start. Or try small, sour candies. Crucially, if you use sour candies, ensure they contain xylitol. Xylitol is a natural sweetener that not only helps stimulate saliva, but also actively fights the bacteria that cause dental decay. Do not use regular sugar-filled candies because while they stimulate saliva, the sugar coating your already dry mouth is a recipe for quick cavities. If you can't find xylitol candy, a small cube of cheddar cheese or a crunchy celery stick works wonders. The chewing action alone tells your brain to turn on the taps. The next strategy is called coat and protect. When your body is struggling to produce natural lubrication, you need to use an artificial barrier. We are not talking about water. We are talking about a thick, protective substance. Over-the-counter dry mouth gels and sprays are excellent tools. These gels contain ingredients that mimic natural saliva, like carboxymethylcellulose. The best time to apply these gels is right before you expect your peak dryness, usually right before lunch, and again before a long conversation or a social engagement. Think of it as sunscreen for your mouth. It buys your mouth hours of comfort and protection until the medication concentration begins to drop later in the day. We have now covered the medication peak, the double diuretic effect, and how to use sour foods to stimulate flow. Let's address another hidden daytime factor that makes things worse. Unconscious mouth breathing. When you are asleep, you likely breathe through your nose, keeping your mouth sealed and moist. But when you are focused on the day's tasks, watching TV, reading a book, or working on the computer, many seniors unconsciously relax their jaw and breathe through their mouth. Every breath of air passing over your tongue and gums rapidly evaporates whatever little saliva you have. This is often made worse by aging because the muscles around your mouth and jaw, especially if you wear dentures, can lose tone, making it harder to keep your lips sealed during concentrated activities. The fix here is awareness and muscle training. Whenever you notice yourself focusing, consciously press your tongue lightly against the roof of your mouth, right behind your upper front teeth. This action naturally forces your lips closed and promotes nasal breathing. Make it a game. Every time you see a commercial on television, check your tongue position. If it's resting on the bottom, move it up. For further vitality, try simple facial exercises. Say the letters O and E dramatically for 30 seconds, multiple times a day. O-E, O-E. This strengthens the orbicularis oris muscle, the ring of muscle that keeps your lips sealed and prevents moisture loss. Simple movement, big difference in dryness. Now let's talk about the critical conversation you must have with your doctor. Remember, we cannot give medical advice, but we can give you the blueprint for an intelligent conversation. You need to ask your physician 3 key questions. First, ask if any of your morning medications are known to have an anticholinergic effect. They will know immediately. Second, ask if it is medically appropriate to adjust the timing of the dose. For instance, sometimes moving a medication that peaks later in the afternoon to a nighttime dose can mitigate the side effect during the day. Your body is less likely to notice the dryness while you are asleep, and the concentration may have fallen before you start your active day. Do not change the timing without explicit direction from your healthcare provider. Third, ask if there are equivalent drugs in the same class that have a lower known risk of causing xerostomia. Sometimes a slight formulation change can dramatically reduce this side effect without changing the drug's primary benefit. Getting a doctor on board is the single most important step in winning the fight against daytime dry mouth. We've covered the pill peak, the diuretic trap, and the breathing habit. Let's recap the simplest action plan you can implement right now, today, to manage your symptoms. First, adjust your hydration rhythm. Stop constant sipping. Switch to 1 full glass of water every hour on the hour, starting 1 hour after your morning meds. Second, implement the sour power technique. Introduce a small amount of xylitol candy or a slice of lemon at the time your dryness peaks, usually mid-afternoon. This manually forces your glands to produce flow. Third, practice the tongue seal. Place your tongue against the roof of your mouth whenever you are concentrating. This simple habit promotes nasal breathing and protects the moisture you have. Finally, think about your environment. Dry indoor air, especially during winter months with forced air heating, pulls moisture from your body and your mouth. A small humidifier placed near your favorite chair or workspace can significantly improve your comfort level by reducing the environmental evaporation. We often overlook environmental factors, but they are a constant drain on your vitality. Managing dry mouth is about strategy, not luck. You have to actively fight this side effect of necessary medicines and daily habits. This isn't just about comfort. It's about protecting your dental health and maintaining your ability to eat, speak, and enjoy everyday life. If you found this video helpful in cracking the code on your daytime dry mouth, please hit the like button. Subscribing to Silver Smile and Bites gives you access to simple step-by-step guidance that helps adults 55 and over live with energy and confidence. We believe that small, evidence-based changes lead to huge results in your overall vitality. Take these steps today. Talk to your doctor and keep that silver smile strong. We'll see you in the next video.